Hey guys, and welcome to How to Gastro. So in today's video, we'll be talking about what is an alpha-1 antitrypsin blood test, which is also commonly known as an AAT blood test. So let's get started. So before we get into the specifics of the alpha-1 antitrypsin blood test itself, let's talk a little bit about what you can expect when your doctor orders this blood test for you. So an alpha-1 antitrypsin blood test is a simple test that can be done at your closest laboratory or hospital. No special preparation is needed for an alpha-1 antitrypsin blood test, which means you don't have to fast, so you can eat and drink as usual before the test. During the test, a blood sample will be collected from you, which means a needle will be inserted into a vein, usually in your arm, to draw out some blood into a gold top or SST blood tube. This blood tube is then sent to a laboratory where it is analyzed and resulted. So what is alpha-1 antitrypsin? So alpha-1 antitrypsin, also commonly known as AAT, is a protein that is produced mainly in the liver that plays a crucial role in protecting the lungs from damage caused by enzyme activity, particularly from an enzyme called neutrophil elastase. So neutrophil elastase is released by the white blood cells to combat infections. But if not properly regulated, it can also break down healthy lung tissue too, leading to conditions such as emphysema. The alpha-1 antitrypsin protein works by inhibiting neutrophil elastase, thus preventing it from attacking and damaging healthy tissues in the body, such as the lung tissue. So from this definition of alpha-1 antitrypsin, we understand that it's a protein that is mainly produced in the liver, and it plays this crucial role or essential role in protecting the lung tissue. So if we take a closer look at this image to the right of my screen, we see the liver here producing these little alpha-1 antitrypsin proteins. And then we see this white blood cell, which is called a neutrophil. And then we see these little pathogenic agents here in green. So neutrophil elastase is produced by the white blood cells to break down harmful bacteria, and this can potentially damage the lungs if the lung tissue gets exposed to neutrophil elastase. So to combat this, we have the liver here producing alpha-1 antitrypsin, protecting the lungs from any damage from the neutrophil elastase. And this alpha-1 antitrypsin protein actually does this by coating the lungs, protecting them from the neutrophil elastase itself, therefore maintaining healthy lung tissue here. So now that we know what the alpha-1 antitrypsin protein is all about, let's take a closer look at what is an alpha-1 antitrypsin blood test. So an alpha-1 antitrypsin blood test measures the level of the alpha-1 antitrypsin protein in your blood. So the test is primarily used for two specific reasons. Number one is to diagnose an alpha-1 antitrypsin deficiency, and number two is to evaluate risk for related conditions. So the alpha-1 antitrypsin deficiency is a genetic condition that can lead to lung diseases like COPD or chronic obstructive pulmonary disease, emphysema, or liver disease. And the second reason this test is commonly ordered is to evaluate risks for individuals who have an alpha-1 antitrypsin deficiency who are at increased risk for developing lung and liver diseases. And so the test here helps in assessing the individual's overall risk. So now that we know what the alpha-1 antitrypsin blood test is and why it's primarily ordered, let's take a closer look at the normal range of alpha-1 antitrypsin. So the normal range of alpha-1 antitrypsin is 80 to 260 milligrams per deciliter of blood, or this can also be expressed on the blood report as 0.8 to 2.6 grams per liter of blood. So this is what the normal range of alpha-1 antitrypsin is in healthy adults. So what happens in cases when we have abnormally low alpha-1 antitrypsin levels? So abnormally low alpha-1 antitrypsin levels in the blood report are often indicative of a condition known as alpha-1 antitrypsin deficiency. So this is a genetic disorder that can lead to serious health issues, particularly affecting the lungs and the liver. So the causes of abnormally low alpha-1 antitrypsin levels include, number 1, genetic mutations. So an alpha-1 antitrypsin deficiency is caused by mutations in the SERPINA1 gene, which leads to reduced production or dysfunctional forms of the alpha-1 antitrypsin protein. The second cause of abnormally low alpha-1 antitrypsin levels is liver disease. So in some cases, the defective alpha-1 antitrypsin protein gets trapped inside the liver, leading to liver damage and contributing to lower levels in the bloodstream. So I want to take a moment now to just explore this a little further. So we're going to explore here how abnormally low alpha-1 antitrypsin levels affect the liver and the lungs. So let's take a closer look at this now. So in patients who suffer from an alpha-1 antitrypsin deficiency or abnormally low levels of alpha-1 antitrypsin in the blood, they usually suffer from certain health risks which generally affect the lung tissue and the liver tissue. So in patients who develop lung disease, we can have emphysema, and this is the most common condition associated with alpha-1 antitrypsin deficiencies, and it involves the destruction of the alveoli or the air sacs in the lungs, leading to breathing difficulties in these patients. This can also often occur in non-smokers, but it is actually accelerated even more in smokers. These patients can also suffer from chronic obstructive pulmonary disease or COPD, and this is a group of lung diseases, including emphysema and chronic bronchitis, and is more likely in individuals who have an alpha-1 antitrypsin deficiency. So these patients can also suffer liver disease, and here we have hepatitis, liver cirrhosis, and liver cancer. So in hepatitis, when the alpha-1 antitrypsin protein gets trapped in the liver, it leads to liver damage and chronic inflammation of the liver, which is hepatitis, which can progress to more severe liver damage over time. We can also have liver cirrhosis, which means scar tissue replaces healthy liver tissue, leading to severe liver dysfunction. And we can have liver cancer. So individuals with an alpha-1 antitrypsin deficiency are usually at increased risk of developing a hepatocellular carcinoma, which is a cancer of the liver. So if we take a closer look at this image on the right of my screen, we see the pathological process that occurs in an alpha-1 antitrypsin deficiency. So here we have the liver, and we have the alpha-1 antitrypsin proteins being trapped in the liver, causing liver damage. So now we'll have liver diseases or liver manifestations of disease. And then we also have the lung manifestation, which means that the neutrophil elastase is uninhibited, causing lung damage. So the lungs lack the alpha-1 antitrypsin coating, leaving them open to damage by the neutrophil elastase enzyme, which means they are now more prone to developing emphysema and COPD. So there we have the lung manifestation as well as the liver manifestation in this deficiency. So now that we've explored what the manifestations of low levels of alpha-1 antitrypsin means, let's talk a little bit about what abnormally high levels of alpha-1 antitrypsin means for patients. So abnormally high levels of alpha-1 antitrypsin in the blood are less common than low levels and are usually not associated with a specific genetic condition, like in the case of alpha-1 antitrypsin deficiency. However, elevated levels of alpha-1 antitrypsin can occur in certain situations and may be a sign of an underlying condition or response to inflammation. So here are some causes for abnormally high alpha-1 antitrypsin levels. So coming in at number 1, we have an acute inflammatory response. So alpha-1 antitrypsin is also an acute phase reactant, meaning its levels can rise significantly in response to inflammation or infection in the body. So conditions like bacterial infections, tissue injury, or inflammatory diseases can all cause a temporary increase in alpha-1 antitrypsin levels. At number 2, we have chronic inflammatory diseases. So conditions such as rheumatoid arthritis, inflammatory bowel disease, or chronic infections can also lead to persistently elevated alpha-1 antitrypsin levels due to the ongoing inflammatory process. At number 3, we can have liver disease. So certain liver diseases, particularly those that involve chronic inflammation or fibrosis of the liver, such as in liver cirrhosis, can cause elevated alpha-1 antitrypsin levels as the liver increases the production of this protein. At number 4, we have malignancies. So some cancers, particularly those involving the liver or other organs, can result in increased alpha-1 antitrypsin levels, and this forms part of the body's response to the disease. And finally, number 5, which is hormonal factors. So elevated estrogen levels, such as in cases during pregnancy or from taking oral contraceptives, can also increase alpha-1 antitrypsin levels. And so the take-home message. So as we have just seen, the alpha-1 antitrypsin blood test is crucial for identifying and managing the alpha-1 antitrypsin deficiency, which is a condition with potentially serious consequences for lung and liver health. So early diagnosis through this test allows for the proactive management, reducing the risk of severe disease and improving the quality of life for those affected. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this presentation very interesting and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community. So if you want to encourage me to do even more, or to say thanks for all the free information you've received on my channel today, you can say thank you by buying me a coffee. So the link to buy me a coffee can be found in the description box below. Take care and have an awesome day further. Bye for now.